have to record your session also, and I give your permission to slide share.
Sure. You've given? Okay. I'll start sharing. Okay. Is the slide visible?
Yes, it is visible.
Just a second. All right. So, such a wonderful Sunday morning, and all beautiful ladies dressed up and here to talk about men, women, and the metabolic health. And nothing better than this topic to start the conference today: developmental origins of metabolic disorders. We all probably intuitively, or by just the nature of existence, know that there is a direct cause and effect relationship between what happens during your development and what results as a health in the later times of life. This topic seems intuitively very easy, but when it comes to scientifically proven it becomes a little elusive and vague. So I'm going to try to simplify or bring together the aspect, scientifically vague looking aspect of this topic into four major sections. One is what is developmental origin of health and diseases. And when it comes to metabolic diseases, the line between health and diseases is very thin. We don't know exactly where the health stops and the diseases start, because the metabolic health is very, very subjective, is affected by social, cultural, individual likings and dislikings, and the influence of the local environment. Then what is development? What are the windows of opportunity where we can peep in and intervene to kind of improve or make the things better? And then at the last, we will see, is there anything that we can do about it, or we can just blame it on the genes, raise our hands and finish it off. So what is DOHAD, DOHA? This is an international society which is formed few years back, and they do not like the word fetal origin. They like the word developmental origin, because that increases the span as well as windows of opportunity to intervene. What it says is that the exposure to certain environmental influences during critical periods of development and growth may have a significant consequence on the individual short and long-term health and diseases. And I would like to add to it that it is not just the individual's health and diseases, but health and diseases of the humanity as a whole will be affected by exposure of a single individual at a particular given point of time. Why I am saying is that if you look at the facts that the genetic similarity between a chimpanzee and a human being is 98%. But the phenotypical differences, I'm sure all of us understand that the chimpanzee looks nothing like a human being. It behaves nothing like a human being, but the genetic similarity is 98%. The genetic similarity between a human and a human, whether it is a South African, whether it is an American or Asian, the genetic similarity is 99.9%. Then where are these differences coming from? If we are genetically so similar, how are we different? And these are the three things that constitute the developmental aspects of our life. That is genome, that are genes, which are probably very similar and take long time to change. There is something called as epigenome. These are the proteins that are surrounding the genes, but without changing the genes, they change the expression of the gene. So the function of the gene can be changed very fast without even changing the gene. And that is what happens with the influence of exposome. I had a very interesting talk with Dr. Yagnik sir 2 days back on this topic, because I had to present this topic on this conference. And he explained me this term of exposome, where exposure during the critical years of growth will have effect on the genetic expression of a given individual, and will also affect what kind of genetic material transfer that individual does to the next generation. And these exposomes include everything that you are exposed to: environment, nutrition, psychological exposure, nutrient exposure, climatic exposure, wars, and everything around us to which we are exposed will affect the developmental process. Now, what is development? Does it mean the development of a child in the utero? Does it mean the development of a child in infancy, early childhood, puberty, youth, reproductive years, menopause, andropause, aging? And does it end at death? Is the death end point of development? It is not a linear process. It is a circular or cyclical process. All these things are cyclical, and the reproductive years will definitely have influence on the development of the next generation, even though a linear development of menoandropause and aging can keep on continuing, but we can definitely influence the development of humanity as such by changing or intervening or at least understanding and making differences in this. Now we have to identify the windows to peep in and intervene to so-called improve or understand the health and the developmental origin of health and diseases. Now, one of the most important short time window, which is very, very receptive by both of healthcare providers as well as patients, is pregnancy. And here I'm going to talk only about two models. One is birth weight and second is exposure to hyperglycemia. There are innumerable more things, but to shorten the topic and to make it understand better, the birth weight model was the origin of the developmental origin theory, where Dr. Barker proposed that lower is the birth weight of a child, higher is the hazard ratio or risk of a person developing coronary artery disease at the later date. Slight extension of this theory, as I said, when I spoke to Yagnik sir, he said that, and I'm sure there are other publications on this topic also, that not only undernutrition, but the overnutrition causing increased birth weight is also something that increases your risk to metabolic disorders. So the graph between birth weight and metabolic disease at the later years of ages is U-shaped. And the point at the base of the U is a continuum. So we exactly do not know what exactly is the weight for everyone to be normal. So it can be maybe defined by a particular individual, but defining a weight should be done by taking into consideration the individual capacity, the cultural and social and climatic environments, the exposomes, and that is how both types of malnutrition, that is undernutrition and overnutrition, will have long-term effects on metabolic health. Now, another model, that is hyperglycemia model, that we have seen that the mother who has hyperglycemia during pregnancy will affect unfavorably to the child's metabolic health in short as well as long term. So higher is the glucose exposure to the child in utero, poorer is going to be the metabolic health of the child in later date. Whether it is type 1 or type 2 is a matter of another discussion, but hyperglycemia exposure during the pregnancy is definitely not good for the child. There is again a gender difference as we are talking. This is an important topic of the female biology getting affected differently than the men biology. This is a biological existence. There is a biological difference between the hormones that men have and women have. What is favorable and what is unfavorable can change according to the change in gender. A small example is thinner men are known to have poorer outcomes compared to shorter women. So length matters. This is not a final call that the height and weight. This is one example that weight might matter in men, height might matter in women. So these are the gender differences that we have to understand so that certain interventions can be planned. So how many lives are concerned when we deal with a pregnant lady? We know the answer to, but if the fetus is a female, then the answer is many more. Not only 3, but many more, because the reproductive cells of a woman are completely formed in utero. So a female fetus when born has all the reproductive cells that the child is going to use forever in her life. So that child's life, the child's daughter's life, that daughter's life, there are many generations which are going to get affected by exposure of a lady to certain exposomes during pregnancy. And that is why it is never too early or never too late to make the things improve, because whatever has happened in the past has decided a certain number of parameters of health, and when improved, they can not only improve that person's life, but the next generations. So it's never late to improve the things. And there are a number of windows of opportunity. We just spoke about the window of opportunity called pregnancy. But let me tell you that there are a number of opportunities because this is a cycle. This is not a linear process. At any stage of a woman's or a man's life, if we intervene by lifestyle changes, by improved diet, by changing the environmental to the favorable thing, by changing the psychological effects into favorable thing, we can make difference not to our but the future generations to come. So there are multiple pathological mechanisms. We will not go into details. So rather than blaming our genes, we know that improved lifestyle during pregnancy improves the later risk of development of diabetes. Whether it is surgical or whether it is medical, weight loss in mother has favorable improvements in the later generation's health. Maternal weight loss is useful. Why only mothers? Like we understand that there is a paternal contribution to the future generation also. It has been shown that even father's exercise improves the glucose metabolism in the offspring in adult life. So it's not only mother who is responsible for the health, it is also the fathers who are responsible for the child's health. Lactation, very important thing to improve the metabolic health of the lady as well as the next generation. And what has been shown is that the risk of diabetes in later life in ladies with gestational diabetes mellitus is half in the women who breastfeed at least for 3 months. So the risk that increases during pregnancy because of gestational diabetes can be brought down by breastfeeding to a large extent. Now, if we are interested in this topic further, there are a lot of theories and the literatures which tell us more about this. For example, fetal programming theories, where it is the advantage the advances and the understanding is improving in terms of certain terms called cumulative stress. As I said, throughout the generations, the accumulation of the material and the genetic information is studied with cumulative stress. The match and mismatch theory, where the in utero child is exposed to a certain environment, let's say for example famine, and after giving the birth, the child is
Actually, we are running short of time.
yeah, this is the last slide. So this mismatch of in utero and ex utero development may cause effect. The things can be studied metabolically or epigenetically and relatively less well advanced, but very important is a psychological theory. So with that, I come to the summary of my topic. We saw what is developmental origin of health and diseases. We saw that development is a continuum. We have n number of opportunity to intervene. Look at these windows at your home and your patients and people around you, and just don't blame it on the genes, because even though we cannot influence genes, we can influence the exosomes and we can influence the epigenome. With that, I would like to thank everyone for the patient hearing and hand over the proceedings to the organizers.
So thank you, Dr. Anjali. It was a very informative talk, especially with regard to what we can do to prevent the onset of hyperglycemia and dysglycemia in the generations to come. This topic has not been so much touched, especially for us physicians. So now I'll hand over the mic to Dr. Kalpana for introducing the next speaker. Thank you so much.
Thank you, Dr. Smita Patil, for that